What is type 2 diabetes? Type 2 diabetes is a chronic disorder that affects the body's ability to metabolize glucose sugar, which is the main energy source for the body, causing an excessive concentration of glucose in the blood, also called non-insulin dependent diabetes, and usually affects adults, as it may occur in children due to the presence of certain factors. Type 2 diabetes in children. Type 2 diabetes develops when insulin is not produced enough by the pancreas, or the body does not respond to insulin properly, and the so-called insulin resistance occurs, and therefore glucose accumulates in the blood. Type 2 diabetes in children often develops gradually, so it can be difficult to notice its symptoms. The causes of type 2 diabetes in children are closely related to overweight in the child and high blood sugar, and it is important that type 2 diabetes in children is diagnosed as soon as symptoms are noticed and treatment is started as soon as possible to avoid complications. The treatment of type 2 diabetes in children depends on the extent of the development of the disease, as insulin resistance can be reduced or exacerbated and blood sugar levels can be controlled in the early stages through lifestyle changes, weight loss, a healthy diet, and exercise. Type 2 diabetes and pregnancy. Some women are wondering about the relationship between type 2 diabetes and pregnancy. The truth is that if a woman has type 2 diabetes, she can still have a healthy pregnancy, but there are some things that need to be considered to minimize the possible risks, and make sure she and the baby are healthy. And there are not necessarily specific difficulties associated with type 2 diabetes when trying to get pregnant. However, other factors may play a role, including overweight or obesity, or polycystic ovary syndrome, PCOS. Losing weight, following a healthy diet, exercising regularly, and taking any necessary medications for PCOS can help increase the chances of getting pregnant. While some women can control type 2 diabetes through diet and exercise, others take medications to help control their blood sugar. Therefore, these women should talk to their doctor to find out if they can still take these medications during pregnancy. Pregnant women with type 2 diabetes may need to see a doctor more often to monitor blood sugar, monitor symptoms, and follow up on pregnancy. Causes of type 2 diabetes. In a normal situation, the body needs energy, so it derives it from glucose when it eats food. So glucose keeps circulating in the bloodstream until the hormone insulin is secreted by the beta cells of the pancreas. So insulin introduces glucose into the cells so that they use it as an energy source. In the case of type 2 diabetes, the hormone insulin is secreted as normal, but the body's cells do not improve its use. So glucose accumulates in the blood, causing a rise in blood sugar levels. This is known as insulin resistance. The causes of type 2 diabetes include the body's resistance to the hormone insulin secreted by the pancreas. The pancreas does not secrete sufficient concentrations of the hormone insulin to adjust the glucose level. Hypersecretion of the hormone glucagon secreted by the pancreas and responsible for raising the level of glucose in the blood. Obesity. Lack of physical activity. Genetic factors. Risk factors for developing type 2 diabetes. Risk factors for type 2 diabetes include genetic factor, or a family member has type 2 diabetes. Having a pre-diabetic condition or prediabetes. Physical inactivity. Overweight or obesity. The incidence of heart disease. The incidence of hypertension. Low levels of good cholesterol HDL, below 40 mg per deciliter. A woman during pregnancy is exposed to gestational sugar. Polycystic ovary syndrome, PCOS. Symptoms of type 2 diabetes. Type 2 diabetes does not show symptoms in its early stages. It is usually detected late, and one of its symptoms is frequency of urination, excessive thirst, excessive appetite, losing weight for no reason, blurred vision, numbness and tingling of the lower extremities, ease of infection with fungal infections, fatigue and general weakness, dry mouth. Complications of type 2 diabetes. Complications of type 2 diabetes include diseases of the heart and blood vessels, neuropathy, nephropathy of the kidneys, diabetic retinopathy, gangrene of the foot, as a result of lack of blood flow and damage to nerve fibers, osteoporosis, Increased chance of getting a bacterial or fungal infection. Hearing disorders. Alzheimer's disease. Treatment of type 2 diabetes. Type 2 diabetes can have a treatment that includes taking a number of measures aimed at maintaining the integrity of various body organs such as kidneys, brain and others. Such actions include the following. Follow the diet recommended by a doctor or clinical nutritionist, usually rich in vegetables, fruits and healthy fats. Minimize sugars, high-fat proteins, unhealthy fats, to avoid hyperglycemia. The focus of the diet is not to deprive the patient of food for a period exceeding 3 hours, to get away from starvation of the body, which leads to a decrease in blood sugar levels. Insulin hormone replacement therapy in advanced cases. Control the level of glucose in the blood through pharmacological drugs and regular exercise.